Emily, and today we're here at Creighton University on this beautiful spring day in the Jesuit Gardens, and I'm going to be talking to John Deskins about the healthcare bill. So John, tell us what's on your mind today.
Well, the talk on the news and the talk at water cooler discussions has been the healthcare legislation that was just recently passed and signed into law. The healthcare legislation is very large and multifaceted, and its phase-in takes place over years, so it's very complex, and there's been some disagreement, there's been some anger, you might even say, just stemming from the complexity of the bill. But I will say that due to its complexity, a lot of people focus on this point or that point. They might even focus on procedural issues within the Congress. There's been a lot of discussion, but I want to talk about the most fundamental parts of the legislation.
So can you give us a little bit of background about the bill?
Well, the basic background is that the bill extends, the bill's aim is to extend health insurance to all Americans. It requires any organization with more than 50 employees to provide health insurance to their workers subject to a fine that comes through the tax system. It requires that individuals who don't have employer-provided coverage buy their own coverage. It provides subsidies to low-income individuals who have to buy their own coverage. It prevents insurers from denying coverage based on pre-existing conditions. It extends Medicaid. It creates exchanges through which individuals can buy coverage, and a whole host of other components are in the bill. Those are the main parts. Also, it has new taxes that help pay for those subsidies and Medicaid extensions.
So why would someone support this bill?
Well, of course, proponents of the bill are motivated by the fact that tens of millions of Americans do not have health insurance. They feel that this is unfair. Based on their value judgments, based on their philosophical view, they feel that it's unfair in a society like ours, with a society that has a lot of wealth. They feel that it's unfair that some individuals, millions of individuals, don't have health insurance and don't have access to adequate health care. The bottom line is proponents of the bill, by and large, are motivated by a sense of fairness. Based on their value judgments, they feel that it's unfair in a society like this to deny individuals adequate health care.
And why would someone dislike this new bill?
Well, on the other hand, there's a lot of reasons to be against the bill. Some people argue constitutional points. They argue that in the Constitution, the federal government has no authority to mandate that an individual buy health insurance. Other individuals argue that it's just not appropriate for the federal government to effectively transfer resources from higher income individuals to lower income individuals. But perhaps the largest argument relates simply to the cost of the bill and the inefficiencies that it may create. The idea is that the taxes that are going to be levied, as I've referred to already, to fund these subsidies and Medicaid extensions, those taxes that are levied primarily on higher income individuals to fund health care for lower income individuals, those taxes will create distortions, and those taxes will create inefficiencies in our economic system. They might cause workers to work fewer hours. They might cause workers to not work as hard as they would otherwise. Workers may not strive to produce as much as they would otherwise. Entrepreneurs may not be they may not face the same incentives to go as far with their business. Opponents of the bill, the bottom line is that by and large opponents of the bill are worried about the efficiency costs associated with the bill. So we have proponents who are motivated by a sense of fairness based on their value judgments. We have opponents who, for the most part, are motivated by efficiency concerns. They're worried that the bill and its taxes may reduce the size of the economic pie, the total amount of output that we have in the economy.
John, what's your personal take on this issue?
My personal take doesn't matter. A lot of people like to put forth their own opinions. That's fine, but that's not the point of this blog. I'm going to express my own opinions through the political system, which everybody should do. But the point of the blog is to boil the healthcare legislation down to its fundamentals. Proponents are motivated by fairness. They feel that it's unfair, they feel that it's unjust to have individuals in their society who lack health insurance. The other side, the question is, what are the efficiency costs that are created by extending health care to everybody? How is that going to reduce the total size of the economic pie? So one has to weigh efficiency versus fairness in making a decision here in this context. By and large, that's the fundamental essence of this argument. And that question, efficiency versus fairness, comes up all the time in public policy. That's one of the most fundamental divides you might see in public policy analysis, and it for sure is present in this context as well.
All right, well, thank you very much.
Yeah, good to be here.